what can this tool do for clinicians' care, who for kids or for people who are going to make that transition? How much can this boost? And what do you guys feel as though that the potential for this can be for the clinician aspect?
I guess an anecdote in, having other faculty, experience this questionnaire who weren't necessarily even involved in the development of it, but, saw it come across their desk in, the process of us validating this tool. It was really interesting to kind of get their feedback, which, one example, one of the questions, in the questionnaire is about, can you specifically explain, how seizures affect your pregnancy, for women with epilepsy. So, an important topic. And the interesting thing that I think some of our, sort of colleagues found, and I can corroborate that this is true, is that you'll get a response on the questionnaire that says, no, I don't know how to do that. And then interestingly, you'll look back in time, in that individual clinician's experience with that patient, and you look to the last time that you met and you wrote down that we specifically talked about that, so it's sort of like, it's a reminder that, we're all human, and that, learning is a process, and we don't always pick up things 100%, and completely the first time. And that, it's very simple actually to just sort of glance at these answers and think to yourself, gosh, my patient's telling me that they don't know anything about how their anti-seizure medicines affect a potential pregnancy in the future. So we should talk about that. It's kind of like the jumping off platform to have a discussion when it might be really, really important.
Another thing that I found in our patient population was, even in some of my patients I have known for many years. Mm-hmm. These are kids who started having, seizures when they were younger, and they have continued to have seizures. But when this is the kind of questionnaire that is presented to them in a very objective black and white fashion, it opens up areas for discussion. For example, there's a question on rescue medicines. How do you know what to do, when you have a seizure in terms of treating a seizure acutely? And not every single epilepsy or seizure type necessarily requires a rescue medication. Mm-hmm. But when that is out there, it's a question that comes up for discussion, saying, is this something I need to think about or worry about? And, that's the kind of discussion is much better had in a doctor's office than a person on the, somebody saying, what do you mean you don't have a rescue medicine? Like, how come your doctor hasn't talked to you about it? I think the quality of discussion, the things that it has opened up, even some of my colleagues who have come up to me and said, this is not a discussion I normally have with my patients, but this has forced us to do this. I think, as I said, it's almost like a positive feedback. You can really empower patients in management of a disease by showing them how their transition readiness is improving. I look at it almost, we validated this for ages 16 and up, 16 to 26 really. But I look at it almost as this group of adolescents is in their second half of high school, while they're thinking about life beyond graduation from high school. I think this becomes part of that graduation process also. And I think that's where we can use this.